193 defendants, $2.75 billion in intended losses. Telehealth fraud is shaking the foundations of healthcare. From illegal kickbacks to lightning-fast consultations, doctors are at risk of being caught up in the storm. Dive into the dark side of telemedicine and discover the legal stakes in this gripping episode. If you like this type of content, please like, subscribe, share. It really helps the channel. The Justice Department today announced the 2024 National Healthcare Fraud Enforcement Action, which resulted in criminal charges against 193 defendants, including 76 doctors, nurse practitioners, and other licensed medical professionals in 32 federal districts across the United States for their participation in various healthcare fraud schemes involving approximately $2.7 billion in intended losses and $1.6 billion in actual losses. So I'm curious, in this post-COVID world, do you believe that you can actually now go back to no telehealth, no telemedicine? Answer in the comments below. Enforcement actions by the DOJ underscores the severity of these risks, especially for physicians who prescribe drugs via telehealth. In a landmark enforcement action, the DOJ charged 36 defendants involved in telemedicine schemes that resulted in over $1.1 billion in fraudulent Medicare claims. These cases spread across multiple states, including Texas and New Jersey, and reveal a troubling pattern of illegal activity that begins with telemedicine companies. So if you are involved in telemedicine, make sure that you are following the appropriate rules and regulations. Clinical lab owners, for example, paid illegal kickbacks and bribes to telemedicine companies in exchange for referrals. This comes up over and over and over again, this idea of, can I use a way to incentivize people? That's hugely problematic. So these referrals were used for unnecessary genetic testing and was designed to detect genetic mutations linked to serious illnesses like cancer and cardiovascular diseases, but it was not used in the patient's treatment plan, making the entire process fraudulent. So make sure that it is appropriate to use in the appropriate treatment plans. One particularly alarming case in the Eastern District of Virginia involved a psychiatrist who allegedly fraudulently claimed for telehealth visits that only lasted 10 to 30 seconds. These minimal interactions were billed as legitimate patient consultations, leading to significant fraudulent payouts from Medicare. So again, if you are going to engage with physicians, if you are going to actually use telehealth, make sure that the conversations are actually legitimate. And again, with these 10 to 30 second conversations, they led to significant fraudulent payouts from Medicare. The DOJ focused on prosecuting such schemes, and it highlights their ongoing commitment to combat healthcare fraud, especially in the telehealth space. And this will save taxpayers billions. For physicians who prescribe drugs via telehealth, these enforcement actions serve as a stark warning. The convenience of telehealth does not exempt healthcare practitioners from strict compliance with federal and state laws. In fact, this actually places physicians under additional scrutiny, especially when your practices involve prescribing medications on remote consultations. Now, in these situations, you need to look at your telehealth platform, make sure that you're engaging appropriately, and if you unknowingly accept referrals or collaborations with a company that engages in illegal activities, you could face legal consequences, including criminal charges, loss of medical licenses, and significant financial penalties. Again, the DOJ is looking. Focus on patient interactions. Don't make sure that they're minimal. And again, these actually serve as the basis for fraudulent charges and underscores the importance of maintaining thorough and meaningful consultations, even in a virtual setting. You have state laws that additionally add on to this. So as a physician, make sure that your telehealth practices are not only clinically sound, but also compliant with the regulatory practices. And given these risks, it is crucial for physicians engaged in telehealth to seek legal guidance. The Kulkarni Law Firm can help you by reaching out to us. We're happy to help you avoid these fraudulent schemes and provide safe and effective care to your patients. Consult with us at the Kulkarni Law Firm. We can help you safeguard your practice, safeguard your license, and uphold the highest practice of patient care and mitigate potential risks. Don't miss out on more content like this. Subscribe now.